Here tonight, former South African Head Director General Precious Matsoso has been appointed as the co-chair of the Global Intergovernmental Negotiating Body. She joins the World Health Organization team as an African representative, which will be responsible for drafting a Pandemic Preparedness Treaty. Matsoso joins us now to speak about this new role. Good evening to you, and thank you so much for your time tonight. Firstly, let's begin just with your appointment to this body, that is the Intergovernmental Negotiating Body. How are you feeling about it?
Well, good evening, Kathy. Good evening, viewers, and my condolences to those who have lost their loved ones in KZN. Well, I'm elated, but also nervous at the same time. I mean, this is a huge and mammoth task because it's basically carrying the world on your shoulders, and with the pressure and tight deadlines because we have to deliver on set deadlines. So it's an extremely tight, but we'll do our best.
What are you hoping that you're going to be able to achieve? And I wonder if the role that you played as, Director General in our health department is going to come in handy for your current position.
Well, that of course will, but I also needed to explain my other role that I played. You may recall, Kathy, that I've worked for the World Health Organization as a director, responsible for public health innovation and intellectual property. So these issues about access, I mean, I've led at a global level when I was still a director at the World Health Organization. But beyond that, I've also been the chair of the executive board, and I led the negotiations for an emergency. The program that you see globally, that is driving the emergency program. I negotiated the resolution that actually established that program. And the Secretary General of the UN appointed me also. I was a member of the panel to look at access to medicines and what the policy incoherence were globally. And more recently, I was on the independent panel for Pandemic Preparedness and Response that was led by President Silife and Prime Minister Clark. So I bring that wealth of experience in that I've been leading negotiations before.
COVID-19 looks like it's going to dominate a lot of the work that you are doing. Speak to us about some of the issues that you're hoping to deal with.
Well, firstly, we've recognized that, there were 4 evaluations that were conducted last year in the middle of this pandemic. And that led to the 4 bodies recommended about 131 kind of interventions that were needed at a global level and at a national level. And I've always maintained that, for any pandemic, anywhere in the world, for us to succeed, we have to take the communities along. So that's the first thing. So, outbreaks start in communities and they end in communities. So what we're going to need to do is to start right at the bottom and work upwards. Frankly, because we cannot come up with solutions that are not best fitted for a country and that are not locally acceptable. So that's the first thing. But internationally, we have recognized that the global governance mechanism need to be reset somehow. And one of the things that we are going to be looking at is governance and leadership as to how do we reorganize and reprogram globally. Secondly, equity has been one major issue. Inequitable access to countermeasures, medical countermeasures, from vaccines to diagnostics to therapeutics, PPEs, oxygen, ventilators. So we are saying that equity must be at the forefront. But one of the key issues that has come up during the discussions and when we're established as a bureau like a board, which I co-chair, was that this process has to be inclusive. So that we can get inputs from all sectors, because COVID affected everyone everywhere. So in our response, and whatever recommendations we're going to come up with, it has to be an inclusive process. It has to be transparent, but we have to work efficiently, because we've lost so many lives. It cannot be that we 6 million lives have been lost, and this pandemic is still with us. So we have to act with speed. So that's why our timelines are extremely tight.
Well, we certainly wish you all of the best in the role that you're taking up, and we'll be keeping in touch to find out about the work, that you continue to do. That was the newly appointed co-chair of the Global Intergovernmental Negotiating Body by the World Health Organization.